Hi everyone, and welcome back to my channel. My name's Sophie, and this channel is chronicling my journey of living my best life with multiple chronic health conditions. Today, as the title suggests, I will be going over what my elevated cardiac pressures mean. To start, just a quick overview of the cardiopulmonary system. Blood returns to the right side of the heart, moves to the lungs, then the left side of the heart before going back out to the body. Going to keep it really simple because since we still really don't know why what's happening with me is happening, a lot of the more detailed points just aren't really relevant. In terms of my results, I'll talk about it in the opposite order. Normally, what happens is if you have a left heart issue, you will have signs on the cardiac MRI or echocardiogram or something like that. And while I had trends that I pointed out to doctors, everything was still within what doctors consider normal limits. But the problem with normal limits is they're the normal size person. And as I've explained in another video, because of the size of my sort of like thoracic cavity, it is smaller than what is to be expected. So you would expect all of my heart sizes and whatnot to also be smaller than expected. So being on the upper edge of within normal limits for someone my size isn't really normal. And moreover, the trend was, to me, obvious in a lot of the measurements on the echocardiogram and cardiac MRI. But regardless, I didn't have those overt signs of a left-sided heart disease. I don't have hypertension. I don't have sleep apnea. I don't smoke, stuff like that. So there was really no reason for doctors to think anything was wrong besides my symptoms and the trends. Anyway, so what happens when your heart sort of compensates for whatever is going on with it, it can get thicker or the cavity of the heart can get larger, and eventually when that can no longer compensate, the pressure builds up. Well, when the pressure builds up in the left side of the heart, eventually that sort of backs up into the lungs. You can get pleural effusions, which is like fluid in the lungs. You can get elevated pulmonary pressures, which would be pulmonary hypertension. And then as things continue to progress, you can get right heart pressures, right heart changes, again, thickening or the cavity is getting bigger, and then again, the pressure increasing, and then fluid building up in the body, showing up as edema. So that's sort of how fluid sort of backs up and why you can get fluid in different compartments when it comes to cardiopulmonary disease. At least that's how one way it works. One possible journey through the cardiac disease cycle. I don't know. It's early, not that early, but I just can't really think very well, apparently. So with me, all of my pressures are elevated. So the left heart pressures were not measured directly. They were measured through what's called a pulmonary capillary wedge pressure, which is used as a surrogate. And it was elevated, it's elevated to such a degree that it is diagnostic of heart failure with preserved ejection fraction, or HFpEF, which I talked about in the previous video. And that is what the medications I am on is trying to sort of help. We don't know the cause of this because, again, no hypertension, I don't smoke, I don't have sleep apnea. I've been obese in the past for a very short time period, but I firmly believe that was mostly fluid, because once I got on the diuretic and then severely cut down my carbs and sodium, the weight flew off. You can even see it through the length of this channel. If you go back and look at my first videos, I weighed a lot more then, and As soon as I did like a ketogenic diet, it just fell off very quickly within a matter of a few months. So yeah, that's one sort of mystery, is I was having the fluid retention before my cardiac pressures were elevated. So what's going on there? We don't know. Similarly, back in 2021, when I had my first right heart catheterization, I had pulmonary hypertension. So my pulmonary artery pressure was elevated, but my left heart pressures were not elevated. So my left heart pressure being elevated did not cause the pulmonary hypertension, though it would make sense that now that my left heart pressures are elevated, the pulmonary hypertension would be worse, which it is. But again, it's not the cause, because the pulmonary hypertension existed before the left heart pressure was increased. So there's still a lot of unknowns. What we don't know, and the doctor even said, like, we might never know the cause. Like, we might never have a diagnosis, because I do not fit your classic HFpEF patient. But that is what the invasive tests say that I have. But yes, so basically it is HFpEF, heart failure with preserved ejection fraction, which basically just means that the percentage of blood my heart pumps out, my left heart pumps out, is a normal percent, but the overall amount isn't a lot. One of the trends I was trying to point out to doctors is looking at the amount of blood that was going into the left side of my heart has been steadily decreasing since 2020. So in the cardiac MRIs and the echocardiogram, I have had that measured that. They have steadily decreased. There are 2 cardiac MRIs and 1 echocardiogram, and each time the blood going into the heart has significantly decreased, and the amount of blood that I am pumping out has significantly decreased. And the same can be said with the invasive test. When you look at it's called stroke volume, which is the amount of blood the heart pumps out with every beat. My stroke volume with every right heart cath has also decreased. Now it's to the point where my stroke volume at peak exercise, which should be a high stroke volume, you want a lot of blood moving when you're exercising, is less than the amount I was pumping out at rest 9 months ago. I did tell the cardiologist this. She said she did notice that on the table I gave her, and said, like, obviously that's not good. So that would explain why I get short of breath with exertion, why I get fatigued so easily, why when I'm just sort of sitting at rest I can get so exhausted, because I'm pumping so little blood per beat. And that's, in a nutshell, what heart failure really is, no matter if it's with reduced ejection fraction, so you're not pumping a large percentage of the blood, or you're pumping a large percentage of blood, it's just a small amount because you're not filling with a lot of blood, is heart failure just isn't pumping enough blood through the body. And regardless of the cause, or whether it's with preserved ejection fraction, reduced ejection fraction, or whatever, it sort of has the same symptoms, and it can have the same effect. Pressure can increase, causing pulmonary hypertension, causing right heart failure and or dysfunction. The problem with that is it's difficult to know whether it is actually a right heart failure, like a failure of the heart itself, or if it's a dysfunction caused by pulmonary hypertension. We'll probably never know. And again, with the edema, it was there before my right heart pressures were elevated, so that's not the cause. Right now, I'm definitely, I'm not fluid overloaded right now. I'm pretty, I don't want to say dehydrated, but I almost passed out getting out of bed this morning. So I am definitely more on the low fluid side, and I still have pitting edema. So I don't know if that's just something I'm always going to have or what's really going on with that. But that's sort of what the elevated cardiac pressures are indicative of. The HFpEF, heart failure with preserved ejection fraction, worsening pulmonary hypertension. We don't know why I have that. And then a right heart dysfunction / failure, which we don't know if it's the heart itself or the pulmonary hypertension. So still a lot of unknowns right now. We are just sort of treating symptoms and the HFpEF because that should help the pulmonary hypertension, which then should help the right heart pressures, which should help the edema. But time will tell. I will obviously keep you guys in the loop. And I hope whenever it is you are seeing it, you are having a good day. And I will talk to you guys in the next one. Bye, guys.